Hi, it's Danielle with Oasis Lactation Services, and today we are going to discuss what to do if you have sore, damaged nipples. Be sure to hit subscribe down below right now so that you can be reminded of all of our cool videos that you can share with your friends as well. So today we have our breast, and let's pretend that there's some damage. Maybe the baby's got kind of a shallow latch, or there's a scab or a cut, and something terrible has happened to your nipple. Well, first, make a call to your lactation consultant and get seen right away. And in the meantime, we can do a little bit of kitchen medicine to get that nipple started on the path to healing. So we're going to use really simple things that you already have at home. We're going to use some warm water. So I'm just going to get that here. I like the water to be pretty warm myself. We're going to put a little more. Put 8 ounces of warm water in our cup. And you can also heat it in the microwave if you want to make it and let it cool and heat it up each time you use it. And I cook with kosher salt, so that's what I have. You can use sea salt, you can use iodized table salt, you can use Himalayan pink salt. The only salt that you would need to change the recipe on is if you use Epsom salt. Epsom salt, you'll have to use slightly more salt to get the right level. So we're going to just eyeball about 1/4 to 1/2 teaspoon. And come on, salt. And just mix that right in. So this is our basic saline wash. And this is what we're going to use to keep our nipple nice and clean. We're going to disinfect the area, and it's warm and it's really soothing. So that's all mixed up very nicely. So now I want to come up with a vessel that I can use to kind of soak my breast. You can use a little tiny medicine cup, if that'll fit over your nipple, just so. Medicine cups are plastic and sometimes they're a little sharp, so a shot glass might be a little bit better for some moms. If you feel like you really want to get the areola and more tissue of the breast in, you may want to go with like a larger juice glass so that you can really get everything soaking. And so what we would do, we'll use the middle of the road glass, is pour in the shot glass, and here's why you should have a towel on hand. Hold the towel under your breast and line things up. And I'm not going to wet my breast model because it's fabric, but you may want to dip down and then lift up and lean back so that the breast is soaking inside the fluid. Just imagine there's some saline in here. And we do this for about 3, 7, 10 minutes, however many minutes you can really spare, because I know you have a small baby at home. And then we'll rinse the nipple in some plain water and pat dry. After we get the nipple all dry, we want to add some kind of ointment or lotion to the breast to keep everything moist. We used to tell moms that dry healing, where we squirt some breast milk on it, rub it around, and let it air dry, would help heal the nipple faster. But what we found is that wet healing is actually superior to dry healing. With dry healing, we get contraction of the wound site. Sometimes even a scab will form. Well, every time milk has to escape the breast, whether it's hand expression, a pump, or a baby, that scab or that contracted tissue has to peel or crack open, which causes more deeper damage and more pain to the mom. So don't air dry your nipples. Now that they've had this saline rinse, they've been cleaned, some bacteria has been removed, they're kind of disinfected and a lot healthier. If you want to rub some breast milk on, that's fine. But let's also add a nipple ointment, and you can use what you have at home. If you got some Lanolin from the hospital, I squirted out a little bit of Lanolin in this cup. Hospitals love to give out Lanolin samples, so grab those. You can put Lanolin right on your nipple. If you don't have Lanolin, or maybe you're vegan and you don't use animal-based products, olive oil will work. If you don't have olive oil, coconut oil will work. And if your healthcare provider has given you a prescription, there is an option for all-purpose nipple ointment. It's real boring to look at, but it contains a steroid and it contains 2 antimicrobial agents. It's also sometimes called triple nipple, and this you get at a compounding pharmacy. It's a little bit pricey, so if your insurance doesn't cover it, you can expect here in Georgia, the price ranges between $40 and $120. So depending on where you live, it will maybe be a different price. But we can put this we'll choose coconut oil today. And you can just put this right over the nipple area and rub it on really good. And then we want to keep everything moist. If we use coconut oil or olive oil or all-purpose nipple ointment, it will absorb into the skin pretty quickly. So we want to maintain some moisture on our damaged nipple. How we're going to do that? Breast pads. I'm going to use a disposable one today because I'm using a lot of ointments and creams that I don't want to get all over our clothes. You can also use a fabric or wool breast pad just as well. And we're going to take some of this Lanolin, because we got tons of it from the hospital. They give away lots of cool samples at the hospital. And we're going to make a big lump of it right here in the center of the pad. And what we're going to do is we're going to line this dot up with our lubricated nipple. That way, as the nipple spends the next, hour to 2 hours until the baby needs to nurse again, in the bra, it's constantly re-moisturized. And we're using the pad so that things don't leak all over and get all over our clothes. So now we've got layers of protection. We have our saline soak to rinse and disinfect and debride the area. Then we have maybe our prescription nipple ointment or another nipple ointment directly on the breast. And then we have layer 3, which is our long-lasting moisture to keep on the breast, to keep everything very, very wet, so that as it heals, it doesn't contract or scab and create more pain next time you go to feed or pump for your baby. So this is a quick tutorial. If you have questions, please sure to leave them in the comments. We would love to talk to you about them. Follow us on Facebook at Oasis Lactation Services, and we'd love to see you at one of our mom meetups. Go to oasislactationservices.com so that you can see if there's one near you, and if there's not, let us know, and we'll see if we can get somebody out there to help you. Thanks.